prevention is the best thing in the world. If we
Great.
can avoid trouble, and obviously not everybody can do that, but if you're either maybe a younger person or you're, whatever age and you've always been healthy, but you're starting to feel yourself sliding, it's way easier to get your health back if you're
Yes.
proactive earlier.
Let's ditch the quick fix and dive into today's conversation.
I'm going to swing back a little bit to the immune conversation because I feel like that's an important part of what we're talking about with cancer, chronic illness, but also with COVID. We're in, a good full 2 years now with this conversation. And I know you've had a lot of conversations, and if you've shared a lot of information, I recommend people check out your sources to get up to speed, because you're doing a great job of sharing current information. With COVID, where are we at today? I've got a few more questions to ask about that, but where are we at today in a summary kind of sense?
If you had asked me 3 years ago if I would, be involved in some fairly broad, high-level discussions about a pandemic, I would have laughed at you probably. But what happened early on was there are international organizations that are very integrative minded, and I was already connected with them on the integrative medicine side of the world with, say, vitamin C and cancer and some, big picture things that I teach about. So early on, I was asked by the Orthomolecular Medicine Society International to do an update on vitamin C, how it works, what we had learned really early on from the Chinese hospitals using vitamin C in the hospital, and how might that translate for this pandemic. And this was really early. We did a free presentation on that I presented, and we had, it was either 6,000 or 9,000 healthcare providers around the world that night. And it sort of triggered, then that just didn't stop, for me going forward. Well, what happens then when you do that is then you start getting involved in, I would have thought, well, I'm not going to get involved with COVID patients and all of this. Well, it turns out that's what's happened. So, a lot of talking to hospitals, which is not always very rewarding and sad for patients, but just sharing, here is the research. And now we've actually had RCTs come out, trials that show vitamin C is a good idea to use if you're in the hospital, better if you're not in the hospital. So just trying to share that. So what's happened, I think, in the last couple of years here is certainly on all sides of medicine, our understanding of the problem has improved. You still, my personal opinion, you still have a lot of hospital-based treatments that are behind the curve. It's very hard to get new things, even during a pandemic. New things into a hospital protocol is very hard. I will tell you just anecdotally that in cases where we have been able to convince, someone in the ICU to get their patient on IV vitamin C and some of the other stuff, that we've had patients leave ventilators, which is not a normal thing. There's a lot of potential benefit. And in other countries, they're doing this stuff. It's more North America where it kind of sticks in the mud about all this.
Right.
So I think, but a few things have evolved. One is COVID, even with the new Omicron variant, which is pretty much everything everywhere in the world right now. We don't know why all, but we know that it is so individual the way it hits each individual person that you have, I recently had a family I was helping, and everybody, they all did the same protocols. Everybody got better except one of them. And that one actually wound up in the hospital and had complications and things. So that you see this where one person's got a cold, one person has almost no symptoms, another person's really, really sick. Same bug.
Right.
What I find, and this is not always, this is not widely received, even though it's in the research, at least not received well in North America, is those concepts that I was talking about with chronic illness or cancer, where you really have to look holistically at the person. COVID is COVID is an exemplar of pushing on your weak spots. So what most people don't know is they have a lot of respiratory bugs that are your immune system's got marginalized and they're not hurting you. Well, you get COVID, you get your lungs inflamed, and suddenly
You've
you got
activated.
3 infections now instead of 2.
Yeah.
And
It's kind of a dormant virus kind of thing.
So every time they look, and they do a study and they take COVID patients and check them for other infections, there's always other infections there because we all get exposed to them. Well, one of the clinical problems is if you don't recognize that and try and beat down, these opportunistic ones, it's maybe not the COVID even that's the biggest problem for you. It's these other guys who are sucking your immune system dry. So things like that, people who are very toxic, or especially people exposed to mold toxins a lot of times suppress your immune system,
right?
But you may not know it. You may just have chronic headaches or, other things, but you get COVID and then you got immune suppression. So it's a very bad combination. So I think on the clinical side, it's getting better. People are doing better. We all know keep everybody out of the hospital if possible. Doctors now are starting to see, well, maybe I need to be a little more aggressive and make sure they don't have some other infections or, other things. Integrative doctors are doing a much better job about saying, let's also, maybe get some vitamin C in you. Let's make sure you got enough vitamin D and all the things we keep hearing about in the news. So I think that now we're more aware anyway, that there's these other factors that become important. And, one of the frustrating things is as soon as a patient has to go to the hospital, which sometimes they do, you lose control of the ability for them to make their own decisions primarily about what's going to happen to them. And so unless the hospital is incredibly open-minded and integrative, the hospital is a tough place to survive still.
It is.
So I think that one of the problems that I've seen, if we're looking at good and bad, on the upside, even in the standard medical community, they're starting to recognize co-infections and other things. May not do a great job working with them, but they're trying to recognize them. So that's getting better, I think. They're definitely trying early treatment to keep people out of the hospital. Great. Many standard physicians now at least know vitamin D levels are important, and do directly affect outcomes. Zinc is important. Yes. Other things that they hadn't talked about before. There's a lot of if you look around the world, there's a lot of early treatment that's available, kind of empirically. So it's just, let's at least give you this and see how you do. Some is natural, some are medications, some are mixtures. North America, we've been very, I think there are political reasons for this. We've been very reticent to implement a lot of those things. And I personally think that would help save a lot of people. Yes. But I think the tide seems to be slowly turning. I think with Omicron, and some of my last podcasts, I get into the statistics of it, but Omicron sort of took the decision-making away from everybody in government, because whether you were immunized or not, or whether you were whatever, you were probably going to get it in one way or another. So they're calling it like the natural mass vaccination of the world, basically.
Right.
Now, sadly, that means a lot more people get sick. So that means a percentage of them will get really sick or even die, which is, we don't want. But there's no way to avoid it. I know of cases of people who are totally isolated and they still got it. It's that good.
Contagious. Yeah.
So I think it's a two-edged sword, Omicron. I think it's forcing people to look into more, home treatment. What do I do to stay healthy? Can I take vitamin D? Can I take my minerals? Can I take, my nutrients? What way could I eat that doesn't hurt my immune system as much? People are now interested in that. And I think that what most of the statisticians are saying is Omicron is having this huge wave just wrapping around the world. And then it starts to drop off. And that might be our gateway to an endemic bug where it becomes like the flu.
Okay. Yeah. And hoping that we kind of get there and we get some strong natural immunity broadly across the planet. It's been kind of sad as I've been following this real closely too, and not anywhere near to the depth that you are, but doctors that are getting good results, and the studies are supporting it, and they're getting censored. And one of the doctors that I follow a bit, Dr. Brownstein in Michigan, was doing great with hydrogen peroxide and iodine IV work, and somebody else is doing ivermectin, somebody else is doing hydroxychloroquine, somebody else is doing just a total natural approach. It used to be that doctors would share those things and they'd be able to help patients better because they were able to share those things. That's been part of the tragedy of this but I tend to follow what you're saying on the Omicron. I think it's going to be a positive thing, even though it's going to be kind of brutal that so many people will have to go through another bug at some intensity. Another concern that I've been seeing and seeing some of the doctors talk about recently, and it comes back to the cancer kind of conversation with the COVID shot. In fact, just yesterday, I read an article that Joe Mercola put out, and it's not even a published paper yet, but Stephanie Steniff and I think Peter McCullough, a couple others are reporting that, and I know that Dr. Corey is reporting this as well, that they're seeing an increased cancer signal in those who have had the COVID shot. Are you aware of any of that or looking into any of that information?
Yeah. One of the other authors on that paper is a colleague of mine from the oncology world. And he's published a number of things with Dr. Seneff and some of those other folks from those big universities back east. On one hand, I would say, I don't feel that I know enough to say, statistically, is the cancer rising, or what are we seeing some other effect? I certainly now am reading a lot about that.
Okay.
And I'm certainly, I'm both horrified, but also very curious about, is this a real effect? Because if it's a real effect, which there are mechanical reasons or, scientific mechanical reasons why it might be. My biggest concern, we can't make it not happen, because if that's happening, it's happening. But my biggest concern is, are we as a scientific community going to do something about it? Are we going to have to reel back some of our, our rhetoric and our directions that we push things and things of that nature? And we're not great at that. In US and Canada, we kind of get on a road and we do
right.
it. And those, some of those authors in that paper have written one or two previous papers that are, if you look at them, they're very well reasoned out, and they're about immunology and COVID and, this whole thing we're talking about. If you follow them through to the end, and even 10% of their predictions are correct, yes, we're going to come out the other side of this with more autoimmunity, probably more cancer triggering, because cancer, we don't like to think about it, but we all make cancer cells every day, and our immune system protects us. Well, as soon as you start moving your immune system to a less stable footing, the cancer cells that might be cleaned up might get missed, or some cancer stem cells might be actually turned on. So I think there's more we don't know than we know about that. But even if you take a step back just to immune problems, whether it's autoimmunity, immune suppression, cancer, et cetera, most academics are saying we could have a lot of that at the end of this, just because the human immune system has been assaulted on a global scale. And then we have, treatment, some of which we, are not as used to using. We're not sure what the downstream effects are.
Right.
Some we're better at using, and maybe we do. So yeah, I think it's that particular paper. I don't know if you link things in your podcast, but that'd be a great one to link if people are interested.
And looking at it, and I know it's not even published or even pre-published yet. And that's one of the signal concerns. There's the heart concerns. There's, the neurological concerns. There's so many concerns that are associated with the injection.
Tonight, I'm doing a class for physicians on COVID and the nervous system. And because I got so many requests for it, because we have people with traumatic brain injury, like, effect. We have people with, obviously loss of taste and smell, but also vertigo syndromes and, all kinds of things.
Tremors.
And what I tell people is, because I kind of see everything, I'm seeing it both after the infection, but also after some of the immunization. So that the immune stimulation is what does it. And just looking, I just narrowed down the research papers to sift through that are the newest. So, COVID's not very old, right?
Right.
It took the kind of the most recent ones because we've learned so much. And there was close to 50 fully published peer-reviewed papers that really get into the depths of this is why this is happening. And it all goes back to immune dysregulation, whether it's by the live virus itself or by the treatment. And if it doesn't maybe hit your cardiovascular system or give you clots, or it doesn't hit your lungs or your kidneys, the same inflammatory chemistry, if it gets to your brain, throws, in whatever direction. There's psychiatric manifestations. The one I've seen, which is very scary, is I literally have patients both, I'm trying to be truthful, but also equal, both post-COVID and post-vax. And it's the same, where they literally have a TBI, traumatic brain injury picture. And it's because their brain had micro swelling or maybe a little macro swelling. And they are recovering just like someone who got in a car wreck and hit their head very hard.
Right.
So the neurological system, and I think what we're seeing is, obviously, if somebody has a heart attack, or if they have a clot, that's about that right away. If their lung problems or their kidneys shut down, about that very quickly. I think now what we're seeing is these neurological things. It's not just you're losing taste and smell. We're getting a big group of neurologically injured folks, and as I say, the research community is trying to explain it, but that's going to be a huge area, I think, that's going to be problematic for people coming and persistently.
Yeah, the downstream effects that they're just going to continue to develop. And I know, again, it's way too early in the conversation and it's way too general. But are you seeing anything initial? I'm seeing patients in my office, which I typically would not see patients in my office post-injection that are having some of these symptoms. And they're asking me, where do I go? What do I do? And I'm trying to refer them out to different sources that I think are good sources for general detox and immune support, the immune suppression. But are you seeing anything in the recent studies on, maybe some detox approaches or that seem to be having some positive? I know some people are taking ivermectin post-injection just to try to control some of those neurological symptoms. And they've had some positives there, but I don't think that's the end answer.
I will just parenthetically say, not that this is probably the best answer or universal answer, but I have had patients, post-COVID, post-injection, whatever, but they're not doing well. And they just said, well, I still have some ivermectin. Should I just keep taking it? Put them back on it. And a lot of those symptoms did decrease. Now, one of the important things, though, about that is that there's other things that could help that way, because ivermectin, beyond killing bugs, is also an immunomodulator. We've been using ivermectin experimentally in cancer for 20 years. And it's not because of the bugs, it's because of the immunomodulation. So to me, that made sense. Well, not everyone can get ivermectin. It's not the best for everybody. What we're also finding, and this is even being published in standard, resources, because doctors are desperate, basically.
Sure.
A lot of the things that you and I might think of as, integrative therapies to help with injuries or trauma or other stuff are turning out to be quite helpful, especially with the neurological follow-ons of these problems. So some of the top ones, it's fresh in my mind because of the class tonight, some of the top things, two botanicals, so quercetin, the bioflavonoid, and curcumin.
Yes.
What's interesting about them is they're both immunoregulatory, but also curcumin is a very potent detox substance. It literally helps your body with metals and chemicals and other stuff. So it probably works on a lot of levels. But quercetin and curcumin have been very, very useful. Some nutrients that we think of, like when people get nerve injuries and things like carnitine, acetylcarnitine.
Okay. Yep.
We use that a lot. That's showing up in research. It starts anecdotal where people just tried it and then it really seemed to help a lot. Vitamin C keeps coming up, obviously. The things we think of on the preventive side become crucially important, like trace minerals and vitamin D and, the basic nutrients. And then as you kind of go down the line, almost everybody can access curcumin or quercetin, for example, and the nutrients, and especially acetylcarnitine, which really seems to pack a big punch. So I usually recommend that people at least have that as a base and then see what's kind of lingering from there.
Okay.
Beyond that, there's, you mentioned ivermectin, of course. There's also something we use with a lot of chronic neurological problems called low-dose naltrexone.
Yeah, LDN.
A lot of integrative providers do prescribe that. And it not only seems to work on the front end of the infection, but it also seems to help on the back end because it's immunomodulatory. So yeah, there's a lot of things that can be done, but the message I would come up with after reading all of these papers and looking at my experience and others is start with the things you already know work for the nervous system, and then get creative, because it turns out it's a neurological injury. It's microscopic instead of traumatic, but the healing part is the same.
Right.
We tend to heal the same way.
Right. Very good. Gosh, this is so good, and we're kind of running the clock here. So I'm gonna kind of challenge you here as we end up with maybe three, what you would say is just a good take home kind of points relative to what we've talked about a little bit today. We're talking about cancer, chronic illness, and COVID, and not just COVID itself, but some of the treatments that have been used and those impacts. But what are some just basic take home points that you would kind of summarize for the listeners?
First off, prevention is the best thing in the world. If we can avoid trouble, and obviously not everybody can do that, but if you're either maybe a younger person or you're whatever age and you've always been healthy, but you're starting to feel yourself sliding, it's way easier to get your health back if you're proactive earlier. Certainly, we need to treat people at whatever stage, but I would much rather a person 1 year into ill health, a lot easier to turn the ship than 5 or 10 or 20 years in. So not ignoring our health.
Yeah.
And you and I talk to people about that every day.
Yeah.
And it's human nature that I'm not that bad, and a year of that and you're not so good, right?
I know.
So prevention. And thinking of it, whether you're super healthy or kind of in a long slow slide, consider when you're looking for healthcare providers to work with, and usually it takes obviously a team because everyone's good at different things. Just think back to when we talked about those big 8 different areas. The sicker you are, the more you really need someone to look at all of those areas, and that doesn't have to be one person.
Right.
You can work with some really great structural and physical medicine people, and then they can work with some people who are really great with maybe the hormone stuff and some of the other things, and they might help you with some of the other things. But I think having team approach, and one of the things I always caution people, because it's just human nature, is they may find one thing wrong that's kind of common in chronic illness or cancer, say a common hormonal problem or an infection. And that's great to find that, but they'll put all their effort into that. And they don't realize that you still have to have a digestive system. You still have to physically, have a healthy body, all of that. So I think, prevention. And then if you're past prevention, getting a team that can step back and look at everything. And that's the same for cancer patients. If you're looking for good quality of life, there's a lot of really great, integrative or naturopathic oncology professionals, and they'll do the same thing. They'll say, I focus, on these things that I know work for. This is the core. If you want to get creative and maybe, say do IV therapy or do hyperbaric medicine or do some other thing.
Right.
I've got friends who can help you with that, and I'll sort of be the orchestrator. So I think regardless of what end of the chronic spectrum you're in, even with COVID, the more of you take care of, the better it'll be in the long run.
Yeah, absolutely. Boy, I appreciate that. And I just kind of want to revisit just real quickly that gut health is so important. It is such a huge part of our immune system, huge part of how our body is able to actually be efficient at the cellular level, which is what we talked about initially. If we can't get the right absorption and the right, tight junctions in our cellular, biome, and try to eliminate the toxins and add the good stuff. So that's a huge one. And finding that team approach is just really, really important. So you have a lot of resources available. And if you could just kind of share those with the listeners to be able to follow up with you. And I highly recommend people do follow up with you on what you're doing.
I had my web folks make a hub website just so you can go to one place and then find all the stuff I do. I have a podcast and a YouTube channel and newsletters and many other things in the books. So it's just dranow.com. So it's dranow.com. And that's the easiest way to find these things. So even if you're, say, a healthcare provider and you're interested in continuing education, you can jump off to that. The public, can get to the podcast or get to the newsletters or the books or whatever. So DRANOW, really simple. Awesome. One stop to find everything.
Awesome. Just a little humor here is there any continuing education credits for doing these podcasts? I know that my study and research to do a podcast, I think is a little bit more than what I do on some of my continuing education.
It is way more. I find, especially with the COVID ones where you're going to get fact checked, you're very careful. I've researched almost as much for some of my COVID public podcasts as I do for my CE work that I do for doctors. What's interesting is there's some, I've had licenses in different states. There are occasionally states that will give you 1 or 2 hours of credit a year for doing presentations. Just send them the outline, and they actually recognize it. I don't think Washington was one of those, but I know Arizona would, and some of the other states I've practiced in. So I wish we got more credit, but it just it's job well done. I guess that's
there you go.
That's all it does.
Yeah, I agree. Hey, well, thank you again for joining us, Dr. Anderson. It's been a pleasure. I do again recommend people check out what you're doing, and you're keeping your finger on the pulse of health, and it's good information, and can't recommend it enough. So hope everybody has a great day, and thank you for joining us.